Hi and welcome. Today we're going to be talking about barbiturate toxicity or barbiturate poisoning. Barbiturates are derivatives of barbituric acid. They can be divided into ultra-short-acting drugs, short-acting, intermediate-acting, and long-acting. Examples of ultra-short-acting include thiopental and methotrexate. Examples of short-acting: hexobarbital, pentobarbital. Intermediate-acting: amobarbital, aprobarbital. Long-acting: fenobarbital and meflobarbital. Barbiturates have a wide variety of uses. They can be used as sedatives or hypnotics. They can be used in sedation, preoperative sedation, before surgical procedures, and they can also be used to treat various seizure disorders. Important facts: celebrities such as Marilyn Monroe and Jimi Hendrix are some of the people who have died due to barbiturate poisoning or barbiturate toxicity. Barbiturates were also used by the Nazis during World War II for euthanasia or pharmacy killing. To the pathophysiology, barbiturates are general depressants of all the cells in the body, but the central nervous system cells are more susceptible to the depression. Barbiturates have GABA-like activity. GABA is an inhibitory neurotransmitter which mostly acts in the central nervous system. Barbiturates activate the GABA receptors, specifically at the GABA-A receptor. The GABA-A receptor is a ligand-gated ion channel membrane receptor that allows flow of chloride ions through the membranes of neurons. So that causes opening of chloride channels and increase in the duration of GABA-gated channel opening. This leads to hyperpolarization of cells and causes depression of the cells. Barbiturates also cause depression of the central sympathetic tone. The central nervous system depression effect of barbiturates occur in a very progressive way. The first effect will be sedation, followed by hypnosis, followed by narcosis, and after narcosis, that's when it can be used for general anesthesia, followed by coma, and then death. It's important to note that barbiturates can cause dependence on tolerance. As we've seen, one of its effects is narcosis. It's also a potent inducer of the hepatic drug metabolism pathway through the enzymes, especially CYP450 system. Hence, it affects metabolism of other drugs. Of important note is that short-acting barbiturates are more dangerous than long-acting barbiturates. The specific signs and symptoms of barbiturate toxicity, which you will see in a patient, are mostly symptoms of depression of the central nervous system, cardiovascular system, or respiratory system. They include slurred speech, ataxia, lethargy, confusion, headache, nystagmus, coma, constriction of the pupils over meiosis, hypothermia, hypotension, or shock. Sometimes benzodiazepines can cause paradoxical excitement, especially in the elderly, or hypersensitivity reactions, which include localized swelling, erythematous dermatitis, or cutaneous blisters. Management of barbiturate toxicity. As with any other poisoned patient, will start with resuscitation. Airway, breathing, and circulation. For the airway, make sure the airway is potent, make sure the patient is breathing, check the blood pressure, check the pulse rate, and put in intravenous access. Also treat coma, treat hypothermia, and treat hypotension. Hypothermia can be treated with use of blankets, use of warm IV fluids, or medications such as bretillium. Hypotension can be treated with IV fluids, can be treated with low-dose vasopressors such as dopamine. The next step is decontamination procedures. This include induction of emesis or vomiting, gastric lavage, activated charcoal, cathartics, forced diuresis, or alkalization of urine. Patients who do not respond to the above measures can undergo peritoneal dialysis, hemodialysis, or hemoperfusion.